Hi students, in the previous class we have discussed about the qualities or characters or roles of a doctor to the society, right? Now we are having two important paragraphs. One is for rights to the patient. What are all the rights the patient is having, right? You just ask the patient complaints and you just send them out, you just send the um, unethical treatment like that you can't do, because patients are having so many rights related to their diseases. Okay. Next one is, with these doctor's characters and with these rights to the patients, how the doctor-patient relationship is going to maintain, and finally to the society how the benefits will occur, right? This is the 1.3 module. This is the class 2. First one we discuss about the roles of doctors. So what are all the rights to the patient? Actually, WIC means return informed consent. For anything, any surgery, any procedure, small or large or huge procedures like cancer, anything, any procedure, giving injection, putting Foley's catheter for urination, putting a Ryle's tube, for any technique or procedures, you have to get the consent from the patient. The Patient Information Act, Right to Information Act, they are always ready for the Right to Information Act. In that, everything, every information related to their doubt, they will get. Refuse treatment. This is very, very important. One patient coming to your clinic, you are telling something, diagnosis, investigations, treatment and cost, but they are not ready to see your hospital or wait to your hospital, but they want to go for alternate. So, they have the right to reduce treatment because they want to go for another hospital. Then go for second opinion. This is also, you are good, patient is also good, but your treatment is not satisfied by the patient. In his mind, he is fixing another one physician, so he want to go for second opinion without any quarrel, without any fighting. Then they know the doctor's details. Who are you, where you did your MBBS, where you did your super specialty, how many years you are having experience, which college you are working, HOD, professor, lecturer, SR, like that. All details about the doctor should know the patient, right? Then know the expected cost of his treatment, right? You diagnose one disease, you admit the patient, you are going to start the treatment. What about the cost? How many days the patient is going to be here? Like that, you have to explain everything to the patient before admission. Then only they will go for pay the money, right? So, they know the expected cost of his treatment. Next one is right for information, that is data collection for any records related to that particular patient is hand over to the patient. Or if you in between, if they want to see the details in the case sheet, we have to show the case sheet to them. They are eligible to see the case sheet, what we have what are all the treatment we have given, in which condition the patient is in the third day of admission, fifth day of admission, post admission, like that. Next one is all investigation and results should be sent to the attenders, patient relatives or patient attenders. If they are asking means you have to tell the results. You have to tell the investigation name. Next one is, suppose a patient is AIDS and HIV, like some diseases they are having, means you should have confidentiality. Don't declare the disease to anyone. Confidentiality, pakka confidentiality you should maintain related to HIV and AIDS like diseases. Then alternative opinion. The patient wants to go for second opinion, that is different. You are having one plan, this treatment is not okay for you. You can go for this alternate treatment. Like that, you can refer your patient to another hospital or another physician to go for a good result or good treatment. Okay. And the last one is privacy during examination is very, very important, right? Most of the places, male patient, female patient, kids, old age, for any patient, the privacy examination should be very, very pakka, right? So, these are all the characters or rights to the patient. Previously, we discussed about the roles of the doctors. So, one hand you are having doctor's responsibilities, another one you are having rights of the patient. With this, how we are going to improve the doctor-patient relationship? Then only it will reflect in the society. The patient also will come to the hospital for getting treatment, right? Here, how to improve DPR? The first one is active listening. Whenever a patient comes to your hospital, you ask them to sit and tell the complaints. Each and every complaint you should record, pakka record, one by one. Don't miss any complaint from the patients. Likewise, you have to give advices and your plan. What is your agenda? For this disease, this is the protocol we have to follow. For this disorder, this is the agenda we should go for. Like that, active listening, good discussion will be must, right? Second one is agendas. For the disease, do you have any agendas? Suppose if you are having agendas means you have to explain to the patient. Third one is non-verbal communications. Patient is in any mood, laughing mood, crying mood, or some quarrel mood. At time they will tell any complaints related to this also. But along with the patients, don't laugh. Along with the attenders, you don't make any noise or harassments or fighting with us. Right? You have to be observer very calmly. That is why non-verbal communication is very, very important to maintain the doctor-patient relationship. Next one is empathize. Always you should make empathy over the patient, whatever patient, male or female, old age, middle age, kids. You should approach the patient with some kind of empathy. Then educating the patients. After listening the complaints, after examining the patients, you have to tell them, this is your problem you are having. Like that, you start one teaching method or teaching points for the patients related to the particular disease. You have to educate the patient, then only they know about the disease and then they are ready to go for further investigations and treatment. That is why educating patient is very, very important. Next one is reassurance. Always you tells don't worry, it will get clear, don't worry, it will get clear. Like that you give reassurance, right? And then give dates for the next visit. That time also you give reassurance with your treatment, like that. Then agrees treatment plan. After discussion of all this, the patient should accept your treatment plan, because you already explained your treatment plan, but the patient's patient is ready to accept the doctor's plan, then only the doctor patient relationship will be maintained. Next one is talking responsibility. Whatever words from your mouth, it has some responsibility over the patient, because you don't know about the patient don't know about the doctor. Here the thing is, I am coming with some illness, you are the doctor, you are going to examine me and you are going to relieve my illness. That is why I am coming to you. I don't know about you, you don't know about me. So taking responsibility, whatever complaint they will tell, whatever help they need, we should very kind, very gracious, collecting the information from the patient and talking responsibility. That is assurance. Then avoid overreacting and underreacting. If the patient is laughing means you also don't laugh. If the patient is cries also, don't go and hug the patient and start crying. Don't overacting, don't underacting. And the last one is you have to establish some boundaries for your treatment or your job. Like for example, if you are a dermatologist, you have a boundaries. You have to give consultation for the dermatological cases only. If dermatological cases related to ophthalmology or any other specialty means, you can call other physicians to come for give the second opinion. Right? Orthopedician, suppose if you are an orthopedician, your patient is having some medicine problem, chest pain problem, cardiac problem. Definitely you have to call the cardiologist to give the opinion, then you have to go for the orthopedic surgery. Like that, you should have a boundaries. Don't cross the boundaries. Don't try to treat all the diseases. I know everything like that minded. Don't treat all the disease. Boundaries is very, very important. Right. So these are all the characters or points which should maintain the doctor-patient relationship. Right. And then we have two types of DPR, doctor-patient relationship, two types. Actually, previously what happens is, all the doctors, they act as a god, or people treat all the doctors as a god. Whatever they say, they are ready to oblige. Whatever they say, they are ready to give the amount of money. Like that, previously, those days. Patient control low, doctors control high. There, that is a paternalization. Paternalization means one-sided judgment only. Whatever the doctor says, that will be correct, that will be followed by the village or patients. Second one is patient control is high, as well as doctor control is also high. Mutual understanding will be there. Then only the mutuality will be there. Right? These are all the some two types of doctor-patient relationship. Don't worry about this. Right? So, introduction about the doctor-patient relationship. Second point is doctor-patient relationship characters or qualities or goals of doctors. Then coming to the right to the patients. Patient is having almost all the rights: consumer rights, court rights, financial rights, corporate hospital rights. Every rights patient is having, because nowadays litigation against the doctor is very easy as well as very common also, because the lawyers are always ready to put a cases over the corporate hospitals and doctors. So you have to look for, you have to give concentration on litigations against the doctors. So after this introduction, you have to mention the rights of the patient, then how to improve the DPR with these doctor's qualities and the rights of the patient. Okay, actually some universities this is 5-mark question, some universities 4-mark question. According to your mark system, you have to elaborately mention about the doctor-patient relationship. Okay.